We originally described bone marrow transplantation. We discovered anticoagulation in the form of heparin and Coumadin. We made major discoveries on this campus, and yet the medical school has only existed in this century. But if you think about how young our medical school is and the range of discoveries that we've made in that brief time, it's quite remarkable.
Faculty of Health Sciences, of course, is the most research intensive in Canada. So there's a high level of talent here, and I think because of its size and sort of location, it's still able to maintain the ability to collaborate with relatively few barriers. It allows people to sort of realize the potential of their work.
McMaster in particular is the perfect size of university to facilitate the type of collaboration that you need to succeed in science these days.
So there's lots of individuals that our students can work with, which makes progress and their career outcome much more successful.
The culture that promotes research is very strong. All the hospitals and all the clinicians and researchers tend to collaborate, and it's not the case in other cities in Canada.
Cutting-edge medical care, world leaders and international key opinion leaders in an environment that's really conducive to physicians and clinicians doing research, pushing the boundaries of how best we should treat patients.
The students in the MD program have advisors who can take on a group of MDPhD students and provide additional mentorship.
We're very fortunate to have a number of mentors who are among the top academics at this institution and in the world.
A lot of really great interprofessional physicians, nurses, midwives, allied health professionals who are working in this city.
Who can provide you the mentorship you need and the support you'll need. And it's something that is hard to find so many world leaders in those fields at one institution.
One of the most exciting things about the program is its flexibility and customizability.
It's really up to you what you want to make of it.
Students can move in and out of the medical curriculum and the PhD curriculum.
It's really given me an appreciation for just how advantageous it is to be in both worlds at the junction of medicine and research.
A lot of the students have really enjoyed that flexibility because you can tailor it to your needs and the needs, whether it's in terms of research or a residency that students want to pursue.
You can be an arts student here, you can be a science student here, you can have a background that is quote-unquote non-traditional and find a supportive community hub for your research.
It's really exciting to see the students from different training backgrounds sharing their different expertise.
We often hear through the grapevine how strong they are, how well they are trained in research, both in the laboratory and in the classroom.
Though they're learning how to do research by working with me, I'm always learning from them because they bring new ideas or a new perspective.
For students to succeed in the program, they have to have a lot of energy and enthusiasm for the work. They have to have a strong work ethic and a passion for what they do.
If you have a good idea and the passion, you usually can make your ideas successful. And I think that is unique at McMaster.
It's a wonderful career where you are both seeing patients on one hand and also working in the lab or doing clinical research to try and actually develop new cures and new treatments for disease that's going to be an impact on healthcare.
Thinking about new approaches to diagnosis and treatment, trying to understand new approaches and the scope of the problem.
Not only are we trained to be quite rigorous and analytical with our research methodologies, but we're also trained clinically to be quite adept at the softer skills of communication, of taking care of patients, of seeing the bigger picture.
The McMaster MD PhD program is making room for new kinds of clinician scientists. I feel lucky every day to be here and to be allowed to do what I'm getting to do.
The bottom line is, I love McMaster University. It's a great environment. It's not only about the pursuit of knowledge, but it's also knowing that the research that's being done here is helping the care of patients, not only here in this region, but also in the country and throughout the world.